Vomiting is the forceful ejection of the contents, such as food, fluids, or debris, of the stomach and upper small intestine. It is typically preceded by other signs, such as nausea, excessive drooling, retching, and forceful contractions of the abdominal muscles and the diaphragm. Vomiting can be caused by many disorders, including digestive system disease, kidney or liver failure, pancreatitis, nervous system disorders, and ingestion of irritating substances and poisons. Vomiting differs from regurgitation, which is a passive motion that does not require effort or contraction of the abdominal muscles. With regurgitation, the expelled food and fluid tends to be undigested and may have a cylindrical shape reflecting the shape of the esophagus. Coughing or difficulty breathing are more often associated with regurgitation than with vomiting. Short-term or even occasional vomiting is generally not associated with other abnormalities. Coughing or long-term, repeated vomiting may be associated with weakness, lethargy, weight loss, dehydration, and electrolyte, salt, imbalance. Whenever possible, vomiting is controlled by identifying and eliminating the cause, while allowing the digestive system time to recover. Vomiting versus regurgitating. Before we get to the causes of vomiting, we need to distinguish between vomiting and regurgitation. When dogs vomit, they are forcefully ejecting the contents of their stomach and upper small intestine, bringing food, fluid, and debris onto your carpet. Prior to this unpleasant display, they usually exhibit signs of nausea, such as excessive drooling, retching, and contractions of the abdomen, rather like we do. Regurgitation is different. Instead of ejecting the stomach contents by force, regurgitation is a passive motion that expels undigested food and fluids. Unlike vomiting, the signs of regurgitation are difficulty breathing and coughing. One way to tell if your dog has regurgitated instead of vomited is to look at what the dog has thrown up. Regurgitated substances are undigested and may keep the cylindrical shape of the esophagus. Time: when is dog vomiting normal? Long-term dog owners know that vomiting is not uncommon. Occasionally, healthy dogs will get sick for no apparent reason and then continue with their day as if nothing happened. Your dog could have eaten too quickly, swallowed something disagreeable, or merely snacked on too much grass. This type of vomiting is usually nothing to worry about. So how do you tell when vomiting is a cause for concern? Your dog is most likely fine if he vomits once without any other symptoms, according to veterinarians. If your dog's vomiting can be described as any of the following, then it is time to start getting concerned. Continuous vomiting, chronic vomiting, vomiting a lot at one time, vomiting with other symptoms, like fever, weight loss, lethargy, anemia, etc. Vomiting blood, vomiting with nothing coming up, bloody diarrhea, suspected foreign body ingestion, seizures. Acute vomiting. When a dog has been vomiting for only a short time, less than 3 to 4 days, and no other signs are present, your veterinarian's examination may include a detailed history, including questions about your pet's possible access to garbage or poisons, a physical examination, including the abdomen, examination of the mouth, and a rectal examination, checking for evidence of blood or eating inappropriate items. X-rays are also appropriate for most vomiting dogs because they can help identify life-threatening diseases, such as an ingested foreign object. Blood, urine, and fecal tests may also be appropriate. If nothing of significance is found, treatment to relieve signs may be all that is needed. Generally, the treatment for short-term vomiting requires withholding food and limiting access to water for 24 hours. However, water should never be withheld unless the dog is receiving supplemental fluids either under the skin, subcutaneously, or directly into the blood vessels, intravenous. Dehydration and other internal abnormalities are expected with vomiting, and withholding water can worsen these effects. Dehydrated animals and animals with kidney or heart disease may require intravenous fluids during this time. If the vomiting has stopped after 24 hours, the dog may be offered small amounts, for example, a teaspoonful, of easily digested food. If no further vomiting occurs, feeding can usually be slowly resumed. Follow the treatment directions provided by your veterinarian carefully. Providing too much or too little water or food during this time can hurt your pet. Acute vomiting, which can be defined as sudden or severe bouts of vomiting, is a serious symptom of quite a few diseases, disorders, and complications.
Ingestion of irritating substances, i.e., garbage, chocolate.
Toxins or poisons. Pancreatitis. Kidney failure. Liver failure. Diet change. Intestinal parasites. Viral infection. Medication reaction. Bloat. Bacterial infection. Heat stroke. Chronic vomiting, long-term vomiting, vomiting that occurs more often than once or twice daily, and vomiting accompanied by blood, abdominal pain, depression, dehydration, weakness, fever, weight loss, or other signs requires a more detailed examination. In addition to blood, fecal, and urine tests as well as X-rays of the digestive system, endoscopic evaluation and biopsy of the stomach and small intestine may be required to determine the nature of the disease. In addition, abdominal ultrasound, computed tomography, magnetic resonance imaging, or other specialized tests may be necessary. Treatment for long-term vomiting is directed at elimination of the cause, if it can be identified. In addition, your veterinarian may need to treat conditions such as dehydration, electrolyte imbalances, and acid-base disorders that may have developed. Drugs to control vomiting can be prescribed for animals with persistent vomiting, dehydration, and weakness. Your veterinarian will evaluate your pet's overall condition before prescribing any medication or treatment. Chronic, frequent, or long-term vomiting is also a cause for concern, especially if it is accompanied by the following symptoms: blood, abdominal pain, depression, dehydration, weakness, fever, poor appetite, weight loss. Other unusual symptoms: vomiting in puppies. A dog vomiting is potentially serious, but puppy vomiting should always be treated as a potential emergency. After 6 weeks, puppies lose the immunity given to them by their mothers. Since young puppies only just begin receiving vaccinations, they are at an increased risk of contracting serious diseases like parvo or parasites. If your puppy is vomiting, don't wait to see if it resolves on its own, call your vet. Diagnosing vomiting in dogs. Determining the cause of a dog's vomiting usually requires several steps. Your vet will ask you questions about your dog's access to garbage, poisons, and toxins, about any recent dietary changes, and if your dog is exhibiting any other symptoms. She or he will then perform a physical examination. If your vet feels it is necessary, she will run any additional tests, such as blood work, ultrasounds, X-rays, endoscopic evaluations, biopsies, and urine tests. Treating vomiting in dogs. Once your vet determines the cause of your dog's vomiting, she will tailor a treatment plan based on the cause and your dog's condition. Vomiting itself can create issues like dehydration, electrolyte imbalances, and acid-base disorders. Your vet will address these problems by treating the symptoms and in some cases prescribing anti-nausea medications. If you enjoyed this video, kindly press the like button. Also, don't forget to subscribe with notifications on, so that you don't miss out on videos like this. Thank you for watching.